And here to discuss the shutdown and its implications for healthcare, let's bring in Dr. Omer Awan. He's a practicing physician and senior public health contributor for Forbes. Omer, great speaking with you. Thank you for joining the show today. And first up, with federal health programs stalled by the shutdown, who's to blame for the resulting body count?
Well, Diego, thanks for having me on. First of all, this is going to have devastating effects for public health. And it's not even a matter of blame. The real casualty here are the American people, because these are the ones that are suffering. It doesn't matter if you're a Democrat or you're a Republican. The American people are going to suffer because of this. If you take a look at even some specific programs that have not been able to be enacted because of the shutdown, like telehealth. 7 million Americans used telehealth just last year. And now that Medicare benefit is expiring, which means that certain seniors who aren't able to go to the hospital because of their physical nature now can't use telehealth, so they can't talk and get medical advice from doctors. People that live in rural areas who have to travel large distances and far distances just to get basic essential health care can't use telehealth, and that is certainly affecting their health. So you can see that there can be a very broad range of health effects because of the government shutdown.
And if insurance premiums double because subsidies expire right during this shutdown, aren't we just taxing the sick?
Well, the Affordable Care Act, which affects, by the way, 24 million Americans, many of these people are vulnerable populations. So people who are of low income, people like children, mothers, elderly with chronic medical conditions. Many of them will lose health insurance, and even if they don't lose health insurance, they may not be able to afford insurance. So again, this means that they may not be able to fill their prescriptions for life-altering diseases, things like diabetes. Imagine if you're diabetic and you need a certain medicine to control your blood sugar levels, but you can't get it because you literally can't afford it. Well, this is going to be a reality if Congress doesn't act fast by the end of December to approve these tax credits for the ACA, the Affordable Care Act. And this is going to be a problem because we're not just talking about affecting a certain small percentage of people. 24 million Americans, remember, are enrolled in the Affordable Care Act. So this certainly can have very detrimental effects on public health going forward.
And Omer, food assistance is getting cut, health checks are delayed. Should we reform the criteria for essential services that should be left out of future budget drama?
I believe we should, because if we take a look, as you mentioned, Diego, SNAP, 42 million Americans rely on SNAP. It's a lifeline for these individuals so that they can afford healthy foods. And when they can't do that, then they tend to pay for cheaper, unhealthier foods. And of course, we know that can exacerbate chronic medical conditions like diabetes, obesity, and some people who are on SNAP, then they'll buy these foods and then they may not purchase other necessities like medications, which can then, of course, exacerbate chronic medical conditions. So the important thing to remember here is that, yes, this should not be included in a future government shutdown because of how critical food is. Food is a necessity for all human beings, particularly the vulnerable who are, I'm afraid to mention, are going to be accountable and suffer the most because of this.
I see. Omer Awan, thank you for your time. Great having you.
Thanks, Diego.